Can you believe that a 5-minute nose job actually exists? And within minutes, you're looking at a different nose in the mirror. This is where no one is thinking about anatomy, blood flow, or risk. Vascular occlusion is considered the most serious complication of non-surgical rhinoplasty. It means your blood flow gets blocked and tissue injury can occur if not treated promptly. And that's exactly why this procedure deserves more respect than it often gets. Let's jump in.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Can you believe that a 5-minute nose job actually exists? It's called liquid or non-surgical rhinoplasty, and every year thousands of beauty seekers elect this procedure to reshape their nose in minutes. A liquid nose job is a non-surgical way, and it's far less expensive in terms of alternatives to reshaping your nose using dermal filler. However, there are risks that you should be fully aware of prior to booking a consult with an injectionist or surgeon. I'm Sam, and this is Beauty Seek. Subscribe now for more straight talk that can help you make more confident aesthetic decisions. The appointment feels deceptively simple. You're seated, you relax, and within minutes, you're looking at a different nose in the mirror. Your dorsal hump is gone, your bridge looks smoother, and your nose looks symmetrical. And for most, the result is an immediate, unbelievable wow. And this is the moment where most people mentally relax. This is where you think, that was easy. This is where no one is thinking about anatomy, blood flow, or risk because visually everything looks perfect. And that's exactly why this procedure deserves more respect than it often gets. But before you book this procedure, you absolutely must be aware of the risk of vascular occlusion. Is not good. And your injectionist should be prepared to take immediate steps to reverse it if it happens. And if they don't, you could, well, I don't want to get too gory. Let's jump in. Inside your nose is a network of very tiny blood vessels that supply blood directly to the skin of the nose. And that blood keeps the skin alive by delivering oxygen and nutrients. And if filler presses on or enters those vessels, then the blood can't flow normally. It's called vascular occlusion. In everyday terms, it means your blood flow gets blocked. Like I said, it's not good. According to a 2023 review in the journal Plastic and Reconstructive Surgery Global Open, vascular occlusion is considered the most serious complication of non-surgical rhinoplasty because interruption of blood flow can lead to skin ischemia, where your blood supply is actually cut off, and tissue injury can occur if not treated promptly. What makes this especially tricky is if, as the patient, you may not feel anything is wrong, at least not right away. There might not be immediate pain because you might be numb from topical anesthetic, and the skin doesn't always react dramatically at first, which is why early signs are so easy to miss if your injector isn't trained to look for them. When our blood flow is reduced, our skin doesn't get enough oxygen and starts to turn pale, dusky, or blotchy. It basically changes color. That color change isn't cosmetic. It's a signal that the tissue isn't getting what it needs to survive. And the longer that signal is ignored, the harder it is to reverse what's happening underneath. When that happens, your circulation must be restored to protect your tissue from lasting unspeakable damage. Often, the filler that was just injected needs to be dissolved fast. This is why your nose should be injected with far more care than your cheeks or your lips, where your blood supply is more spread out, if you will. In other areas of your face, multiple vessels often feed the same area. So if one pathway gets stressed, blood can sometimes reach the tissue through another route. That's what doctors mean by redundancy, when tissue has more than one supply route. The nose has fewer of those redundant backups. Think of your cheeks like a city with multiple side streets. If one road is blocked, traffic reroutes. The nose is more like a narrow bridge. If something interrupts flow, there isn't an easy detour. Under the skin of the nose, there's very little margin for error. The anatomy is tight, compact, and unforgiving. In areas like the cheeks, filler has more space to spread and settle. In the nose, the same small amount of filler can change how nearby tissues press against each other much more quickly. That's why you should be sure your provider works slowly during a liquid rhino. They should be pausing and observing as they go. They should be watching how the skin looks, how it feels, and how it responds in real time. And this is where individual anatomy matters. Two noses can look nearly identical on the outside. Under the skin, the paths blood vessels take can be very different. Some vessels sit safely deeper beneath the surface, and others run closer to where filler is typically placed. Previous filler or surgery can further shift how those tissues and vessels behave. This is why two people can walk in asking for the exact same change, and one can proceed smoothly while the other requires stopping, changing course, or not treating at all. That's the difference. It's not about the procedure, it's about talent and the anatomy. So your injectionist liquid nose job plan may need to shift during treatment because something may go wrong, or simply because your anatomy is responding differently than expected. When doctors say a plan requires adjustment, they mean they're responding to what the body is showing them in that moment. They may stop, change placement, or choose not to add more filler. Liquid rhinoplasty can be so helpful for many concerns, like most amazingly smoothing a dorsal hump or masking a crooked nose. Another 2023 review in Plastic and Reconstructive Surgery Global Open indicated complications of non-surgical rhinoplasty to include skin injury, tissue loss, and in rare cases, vision-threatening events when vascular occlusion is not recognized and treated early. So, before proceeding with a liquid nose job, a simple question to ask your practitioner could be, how does my nose's blood supply affect how you do this treatment? Then listen closely to how they answer. A thoughtful provider will talk about anatomy, caution, and how they adjust in real time. A vague answer usually means the question hasn't been considered deeply enough. That question hopefully will shift the conversation from speed and results to safety and decision making. Next, we'll cover a technology that many providers are using to improve the safety of non-surgical rhinoplasty. Subscribe to Beauty Seek for more straight talk so you can make confident aesthetic choices.